being monitored in the hospital was very uncomfortable. I had wires hanging all over my chest. It was, at times, even getting up to go to the bathroom, it was an inconvenience, moving everything around. Sitting in the bed was no fun at all. Any type of movement in the bed would create the monitor beeping. It was no fun.
I was very concerned about going home because I, as a nurse working critical care, I was aware of the complications that could occur while he was in the hospital. And if he did change his rhythm, I wanted to make sure that it was noticed early. It was. They did do a good job.
I was hoping to get comfort by using the PSE. I was able to come home and put this patch on and know that, one, I'm being monitored properly, and I'm in the comfort of my home. So it was fantastic. It was really easy to set up and use it. It's, you know, the patch is about 5 inches long. You take the battery post out, pop it on over your heart, as you can see here, and that's it. And then the rest goes right into the pad here, and that's all you got to do. And then you can just go about your day.
Well, the PSE helped me because it collected the information such as his heart rate, his ECG rhythm on demand, and also his respiratory rate. Also, in addition to those items that a nurse like me likes to collect, we were able to get his blood pressure and his pulse oxygen saturation levels as we needed to, which we did every morning, to allow us to determine how his medication was working. What was very helpful for Mike with the Isansys PSE, being that he was on the antiarrhythmic drug and still continues to be, amiodarone, that is helping him stay out of the rhythm atrial fib that we don't want him to be in. And I was able to watch the medications work by watching his rhythm on the monitor and through the point cure chart. The mathematical formulations that this gives any layperson a good visual of how the heart is working. The amiodarone was kicking in, and I could see the arrhythmias or his irregular heart rate variable become regular or more irregular depending on the medication level in his bloodstream. It gave me the comfort of knowing that it was monitored. We did have multiple physicians able to sign into their laptops and their phones to take a look at the server information that we provided to them. So at any time, if I had any questions, I was able to call any physician and get input, or they could also call us if they noticed anything that was irregular from the physician standpoint. Again, this gave me comfort and control as a nurse because this is what I'm accustomed to when I take care of a patient. So he was able to transition from the hospital to the home, and we could gain almost the same information that we could from the hospital.
I feel great. Really nice things about this device is that it is color-coded, so I could look at this, me not even being in a medical personnel, and notice that, oh yeah, it's in the green area. It means everything's going very well for me. And I could make adjustments to what I'm doing, sit down, relax, whatever I'm doing at that particular moment, and change that method of what I'm doing.
For Mike, we were able to, along with the physician input, wean his antiarrhythmic down faster than maybe we would have been, because we were able to determine whether Mike was ever an atrial fib or not an atrial fib at home. Unlike most post-op patients, they are not monitored at home post-cardiac surgery for atrial fib.
I am still being monitored by the PSE. It's on right now. And the comfort level of it. Again, I could look at the chart, see if I'm in the green. If it gets into the yellow, oh, it's in the yellow. I better just slow down a little bit with what I'm doing, get back down to the green, and proceed with my day.
And periodically, I can go ahead and hit a button, and I can look at his ECG on demand at any time.
Looking at this, we can determine that everything's fine. I don't need to go see a doctor because when there's an unknown. We know.
Mike's physician is well aware that he is being monitored by the PSE, and that if he does go into atrial fib or has any irregular heart rate problems, that we will notice it on the Isansys PSE, and I will call a physician. The physician knows that, and this is our plan.